Hello, I'm Dr. Alan Thornhill and I'm the UK Country Manager at Igenomix. I'm going to tell you briefly about our Endometrial Receptivity Analysis, ERA, or ERA test. Many IVF cycles result in implantation failure, even after transferring good quality embryos. To explain this, there's been a focus on the morphology and chromosomal status of the embryo. However, another key factor for IVF success is the state of the endometrial receptivity at the time of embryo transfer. By investigating the gene expression or transcriptomic profile of the endometrium, we can evaluate endometrial receptivity as a critical parameter for women's reproductive health. We use a test designed, developed, and patented by Igenomix in 2009, after more than 10 years of research. We call this ERA or ERA. ERA is a molecular diagnostic test using next-generation sequencing technology to analyse the expression levels of 236 genes involved in endometrial receptivity. The results provide a personalised genetic profile which indicates whether the endometrium is ready and receptive or not for embryo implantation. The aim of the ERA test is to identify a possible displaced window of implantation, enabling a personalised embryo transfer for each patient, thus increasing the chances of pregnancy. The ERA test requires a standard endometrial biopsy that should be carried out under the same conditions for which a blastocyst transfer would be performed in a frozen thaw cycle. The ERA test will evaluate whether the patient's endometrium is receptive or non-receptive at the time of the cycle when the biopsy was taken. If the patient is receptive, the embryo transfer will be performed under the same conditions and timing in which the endometrial biopsy was taken. However, if the result is non-receptive, there are two possibilities. The endometrium may be pre-receptive and has not yet reached the optimal stage of receptivity, enabling implantation. In this case, 1 or 2 more days of progesterone supplementation will be needed before embryo transfer. Alternatively, the endometrium may be post-receptive, indicating that the optimal stage of receptivity has passed. In this case, the patient will require a shorter period of progesterone supplementation before embryo transfer. The ERA test can be performed either in a natural or medicated hormone replacement therapy or HRT cycle, depending on the planned type of cycle in which the later frozen embryo transfer will be performed. Please note that ERA is not suitable for planning embryo transfer timing in fresh ovarian stimulation cycles. The ERA test is indicated for patients with recurrent implantation failure after transfer of good quality embryos. With more than 10 years of research and over 25,000 ERA tests performed to date, our professional, reliable and approachable team of specialists is available to help guide both you and your patients throughout the whole process. Thank you for placing your trust in Igenomix. We look forward to working with you.